Hi there, I'm Lauren, a specialty practice leader for neurosciences ICU. I just wanted to take less than 3 minutes to give you a quick update on the management of patients with lumbar strains. So this update is specific to the practice of using a transducer on a lumbar drain, and one of the reasons why we might do that is if we're taking care of a patient who has had a graft placed in their abdominal or sometimes thoracic area aorta, just like in this picture. So as a quick refresher, this is kind of like what the graft looks like. Sometimes when they do that, there's a couple different ways they can put the graft in, which is out of scope for this conversation. But basically, the reason why we're going to transduce a lumbar drain in this type of patient would be for this reason. Hold on a sec. So take a look here. You can see here's our aorta, and then look at these spinal segmental arteries that are coming off, and these are feeding the spinal cord right here. But if we have a graft that's running through here because there was an aneurysm here at some point or somewhere near here at some point, then these little arteries might get impeded or cut off, and they're not going to perfuse the spinal cord as well. So one of the things that we're hoping for is that if we can create a lower pressure within the spinal cord, arterial pressure in adjacent areas might perfuse that area of the cord better. So what we would do is in certain increments drain off CSF to try and keep the pressure within the cord low so that that arterial perfusion can be theoretically less impeded based on the perfusion gradient. So the first important thing I want to show you is this transducer is a flushless transducer, and so by that I mean there's no pigtail on here. We're never for a subarachnoid space going to use a flush system on our transducer, so you don't need that pressure tubing with the bag. Please don't use that. Here's a quick look at what some of the order sets may look like. When you take a look at this, they'll say typically when your pressure is this, you'll want to drain off X amount. So make sure you check your orders. Your orders should give you information about what level to level your transducer to, and also what your pressure goals are and how much you're going to drain for each pressure goal. And of course, if you ever have questions, make sure and ask someone, either the vascular team or surgery, somebody. Just always resource someone and ask, because these drains can be definitely, depending on your area, low frequency use with a lot of risk if not done correctly. So thank you for this 3 minutes where I can explain to you this very quick practice update where sometimes we will transduce a lumbar drain. That is not for an ICP reason. That is for keeping the pressure within the cord at a certain goal that will be prescribed by the treatment team. Thanks.